नमस्कार भाइयों और बहनों, सलाम अलैकुम, सत श्री अकाल once again. Dr. Kapoor, your own doctor, your family physician, your family cardiologist is with you. We always try to come with good topics to make you more healthy. And this season, or festival season was going on, so there was a lot of material to be provided to my friends. बहुत सारा मटीरियल ਅਸੀਂ ਦਿੱਤਾ, ਕੋਸ਼ਿਸ਼ ਕੀਤੀ ਕਿ ਤੁਹਾਨੂੰ ਫੈਸਟੀਵਲ ਸੀਜ਼ਨ ਵਿੱਚ ਖੁਸ਼ਹਾਲ ਰੱਖੀਏ, ਹੈਲਦੀ ਰੱਖੀਏ, ਜਿੰਨਾ ਵੀ ਅੱਛਾ ਰੱਖ ਸਕੀਏ ਰੱਖੀਏ. ਬਟ ਇਹ ਫੈਸਟੀਵਲ ਸੀਜ਼ਨ ਵਿੰਟਰਸ ਵਿੱਚ ਪੈਂਦਾ ਹੈ, ਸਰਦੀ ਬਹੁਤ ਹੁੰਦੀ ਹੈ, cold weather. So today I just want to tell you something about hot and cold weather. You know, we are all cold-blooded, warm-blooded mammals. जिन्हें मैमल्स होते हैं ना, वो 37 डिग्री अपना टेम्परेचर बॉडी का रखते हैं, ना उत्तर जाना देंगे ना नीचे. तो गर्मियां में गर्मी होंगी तो पसीने नाल अपनी हीट कटते हैं. सर्दियां में सर्दी होती तो अगर ठंडा होता चला गया तो वी लैंड अप इन व्हाट इज कॉल्ड एज दी फ्रॉस्ट बाइट्स हो जाते हैं, हाइपोथर्मिया हो जाता है. सुनिया होगा ना, द स्कीमोज द हाइपोथर्मिया हो गया बिकॉज ऑफ द कोल्ड, स्किन इश्यूज एंड ऑल. दैट इज वन थिंग. बट कोल्ड really affects the modern diseases much more than anything else. Cold flu da weather aa gaya, fir to aa gaya. People think it's COVID or corona related, but most of them are, you know, the same influenza which comes every year. And every year we are very particular before winter to give all our patients, especially the one who are prone to develop this infection, pneumonia, bronchitis, COPD and all, influenza vaccine, Pneumovix, so that they don't develop these complications. But heart, the news में आज इस वास्ते ले आया कि आज मेन न्यूज़ चल रही सी. I belong to a city of कानपुर, यूपी ਵਿੱਚ एक सिटी है कानपुर, जितने मैं पलिया बड़ा होया हूँ. Well known city, industrial town. But there the main news was running today that yesterday in my ICU where I used to work, in LPS Institute of Cardiology, there were 17 deaths in one day. 17 deaths in one day, about 125 or something plus deaths in one last 7 to 8 days. There are right now 680 patients, they told me yesterday, they were admitted with heart attacks, accelerated hypertension, stroke. It's a very big institute, very good institute. I have studied there. I have all respect. It's my alma mater. But see the load they are getting. This is all blamed. I was talking to the doctors there. It has been blamed to the cold weather. The modern disease of heart is no more a poor man's disease, a rich man's disease. The poor gets the same issues now as the rich used to get. Before, blood pressure and diabetes यार पैसे वाले बंदे ने उन्होंने हो गया होएगा. But आजकल वो across the table सामने होता है. And this news came to me as a shock. I had attended one of my busiest ICU in those days in 88, 89, 90. There were about 3 deaths in that night when I was working as a registrar specialist cardiology there. तो मैंने बड़ा अजीब जा लगा. मैंने कहा, of course the population has gone up, but winter is the bite which has bitten the skin but killed the heart. So why heart attack is more common in winter weather than the cold weather? This is simple basics. Ki mammals, we want to maintain our temperature. In that process, what happens? The arteries, jo circulation bada fast ho janda hai once you are exposed to cold weather. Vasoconstriction, arteries no constrict hona penda so that they run the blood very fast to generate the heat. And that generation of heat depends upon the heart activity. The heart has to pump more. It increases your blood pressure. The pumping of the heart, the load on the heart is more. And once the load is more, it increases the blood pressure. It causes injury to the arteries. And those arteries which are carrying even a small clot causes the burst of that clot. The clot gets busted, cracked, and gives rise to what is known as the thrombus. A clot banda pura patient में heart attack हो जाता है. This is all process. Same happens with the diabetes. People eat more, keep up with the heat, cold weather outside, and in that process the sugar also gets out of control. The blood becomes thickened. Same happens with the fatty food people start eating in the cold weather. Oh, gajrela kha lo, thodi pinia kha lo, all type of foods we get. It's good to have it, but then you have to understand, as a heart patient, especially who are prone to all these problems, they have to be very, very careful. वेरी केयर। तो ब्लड प्रेशर बढ़ता है, ब्लड थिक हो जाता है, हार्ट से लोड ज़्यादा होता है, तो मोर प्रोन टू हैव हार्ट अटैक। दिस इज द एक्सप्लेनेशन। तो असी करना क्या वे भाई, विंटर तो आएगा, हर साल आएगा, द विंटर्स विल बी देयर, बट असी अपने को फैशनेबल नहीं दिखाना कि ओ चलो यार विंटर तिक्की हो जाए, मैं दौड़ के ठीक कर दूंगा, एक्सरसाइज कर लेंगे, हीट जनरेट हो जाएगी। माइंड यू, in the cold weather you should not overdo the exercise which has been prescribed to you. मैं एक्सरसाइज से भी एक दो टॉपिक्स कर चुके हैं पहले वीडियो में, दसिया कि एक्सरसाइज करनी है, डॉक्टर दी अगर राय मशवरा ना हो तो एक्सरसाइज करो, स्पेशली वंस यू क्रॉस द एज ऑफ 35-40, प्लीज डोंट गो। Make sure that your heart is okay, is responsive to the exercise and the amount of exercise which is prescribed to the doctor, you should take it. But don't overdo in the winters. Try to do indoors. And even if you have to go outdoor, do the prescribed amount of less than prescribed. Maybe do 80-70% of what you do normally and keep yourself well covered. Muffler laga lo, kan, all the areas where you think the cold exposure will be harmful. The cheeks are there, the ears are there, the nose is there, face as a whole. Leggings follow. And you can. But if you can do indoor, if you are privileged enough to have your indoor tracks or wherever you can, this is the time you can go to the gym, which is conditioned well to the heat. I'm saying here it's not by fashion you're going. For sometimes you have to fight with the nature also, and this is how you fight, that you withdraw yourself or do the less amount of prescribed exercise with well covered, not getting exposed to the cold and not allowing the body system to get disturbed so as to bring you into the ICU of Institute of Cardiology and where the mortality is high. I'm not terrorizing you or putting a fear factor, but this is a fact of life which we have to understand. भगवान का वास्ता है कि अपनी एक्सरसाइज ओनी रखो जितनी जरूरी है, थोड़े विड्रॉ करके अच्छी तरह करो, खाना पीने का भी उतना ही मॉडरेशन रखो जितना जरूरी है। बॉडी gets calories and heat generation power not only by fats and fatty and tasty or junk foods. The normal food also will generate the heat. The body, God has given a sufficient amount of enzymatic system to take care of that. तो ये बड़ी इंपॉर्टेंट चीज़ है। नाल बड़ी इंपॉर्टेंट चीज़ है कि लंग ते हार्ट डिजीज कई बार पैरेलल चलते हैं, निमोनिया हो जाता है, COPD स्मोकर्स होंगे ना, COPD होंगे कहने ब्रोंकाइटिस, हर सर्दी एग्रवेट, एक्चुअली लंग्स दी प्रॉब्लम भी बहुत होंगी ने, इवन मोर देन द हार्ट प्रॉब्लम, बट दे बीइंग लिंक्ड टू ईच अदर। भाई तुहानू ब्रोंकाइटिस हो गई अगर तो तुहाडा ऑक्सीजन लेवल फॉल डाउन करेगा, एजमा है तो ऑक्सीजन लेवल सर्दी को एक्सपोज करोगे, एक्सरसाइज करोगे तो योर लंग्स एयरवेज विल गो इनटू स्पैज़म, less oxygen to the heart, more load to the heart, you end up with the heart issue. तो अगर तुसी बाई दी एक्सरसाइज करते भी हो and you are asthmatic, you have COPD, take care that you again don't overdo it, be moderate and take an inhaler which you have been prescribed by your pulmonologist or a pulmonary doctor. उन्हें लेके चलो, आराम नाल एक्सरसाइज करो so that you don't induce, you stimulate your pulmonary bronchioles या जो airways दें, so that at least you don't become breathlessness. तो कोई भी एक्सरसाइज, कोई भी एक्टिविटी ऐसी ना करो जिससे तुहानू ब्रेथलेसनेस हो, जिससे ब्लड प्रेशर बढ़न चांसेस होन। तो दिस इज वेरी इंपॉर्टेंट that you take care of your lungs and heart both. If lungs are taken care of, the heart will be taken care of. And if your programmed action as per your doctor advice goes, ਤੁਸੀਂ ਆਰਾਮ ਨਾਲ ਐਕਸਰਸਾਈਜ਼ ਵੀ ਕਰੋਗੇ, ਆਪਣੇ ਹਾਰਟ ਨੂੰ ਵੀ ਮੇਨਟੇਨ ਰੱਖੋਗੇ ਐਂਡ ਖੁਸ਼ਹਾਲੀ ਵਿੱਚ ਰਹੋਗੇ ਤੇ ਵਿੰਟਰਸ ਨੂੰ ਅੱਛੀ ਤਰ੍ਹਾਂ ਫੇਸ ਕਰੋਗੇ। That's what I want to share with my all dear friends, and please keep on coming to us with all the information you need. कोई भी इंफॉर्मेशन हार्ट ਦੇ रिलेटेड, लंग्स ਦੇ रिलेटेड, बॉडी ਦੇ रिलेटेड, हेल्थ ਦੇ रिलेटेड होए, ਅਸੀਂ ਤੁਹਾਡੇ ਸਾਹਮਣੇ ਹਾਜ਼ਰ ਹਾਂ and we will give you the best advice. May God bless you. Keep your health and heart healthy. Namaskar. Thank you.